I welcome you to the Healthy Heart, Healthy Life Pune, session 12. I am Dr. Neelkant Karandikar, Chief Cardiologist at the Heart Clinic, Mukund Nagar, Pune, Alpha Diagnostic Center, Tilak Road, Raghav Diagnostic Center, Jangli Maharaj Road. I am the interventional cardiologist at the Ruby Hall Clinic, Sahyadri Hospital and Deenanath Mangeshkar Hospital, Pune. And I'm the honorary professor emeritus in cardiology, also the first gold medalist of the Bombay, now Mumbai University at the DM cardiology examination. Today's topic is quite interesting. Heart attack features, men versus women. We all know about the features of heart attack, many of us, but some of us may not be knowing that the features can be different in men and women. And let us talk about this very important topic today. God created men and women equal, and He created them different. Different doesn't mean one is inferior or superior to the other. It simply means different. The difference between men and women are necessary, very much necessary, because of their God-given purposes. A very, very vital quotation by Oladel Dosunmo. Whenever we talk about heart attack, most features that we talk about are, absolutely concerning men. And the heart attack, as far as whenever we image somebody having a heart attack, a man holding his chest like this comes before our eyes. He has a blocked artery in his heart, he's getting severe chest pain, and that is a tightness in the chest and pain in the chest. But we must know that heart disease, how it differs in men and women. Yes, heart disease is the leading cause of death in men and women, but it can develop and present in dramatically different ways across the sexes. Heart and blood vessel size, let us talk about them. Women have smaller hearts. Women have narrower or smaller blood vessels, that is coronary arteries especially, supplying blood to the heart. Because of this, heart disease may develop and behave differently in women. Key message is one size fits all heart care does not work for everyone. It's different for men and different for women. When cholesterol builds up and blocks the arteries, as we know, is the cause of heart disease, the main cause atherosclerosis. In men, the plaque usually builds up in large heart arteries, and in women, plaque more often affects small blood vessels or the smaller coronary arteries. And therefore, the key message is even if the angiogram is normal in a woman, you cannot always say that no heart disease is present because the disease could be present in the smaller arteries of the lady's heart. There is a very important issue of menopause in ladies. Let us talk about menopause transition and coronary artery disease. Transition from a period of low risk premenopausal stage to a high risk postmenopausal stage. You will hardly see, though there are exceptions. One of my patients was just 24 years old and I have done her a coronary angioplasty. So, but in younger women, especially in the childbearing age, up to the age of 45 roughly, there is usually no coronary artery disease seen. Whereas once the menopausal age is crossed, it is the high risk postmenopausal stage where heart disease starts cropping up. Menopause and heart disease risk in women, let us talk about it. Why does menopause matter? As women age, the risk of heart disease increases. When does the risk of heart attacks increase? About 10 years after menopause, heart attacks become more common in women. This is very important to know whether you are dealing with a young lady or a senior lady, elderly lady. Hormonal changes occur after menopause. And because of this, these hormonal changes after menopause, the blood pressure rises, there is higher blood pressure, increase in blood fats, cholesterol and LDL, rise in LDL cholesterol, and drop in the good HDL cholesterol. Because all of these changes, coronary artery disease after menopause starts rising. Let us talk about now again about the men. Signs of heart attack in men. Men have more typical symptoms like chest pain. Intense chest pain or pressure is the key symptom usually in men. Arm pain, pain spreading to the left arm can indicate a heart attack in a man. Cold sweats, experiencing cold sweats is a common symptom. Dizziness, sudden dizziness can be a sign of heart attack in a man. Breathlessness, shortness of breath is a serious symptoms because it indicates that the heart attack has weakened the heart is not pushing out enough blood, and because of that, there is congestion of blood in the lungs and the person feels shortness of breath. We call it dyspnea in cardiology terms. These symptoms are often dramatic and quickly recognized as an emergency. Now let us see what happens in the women. Signs of heart attack in women. Women often have subtle symptoms. Fatigue or weakness, feeling unusually tired or weak. This can be a sign of heart trouble. Nausea or vomiting. Experiencing nausea, vomiting, or indigestion like discomfort. These symptoms can indicate a heart problem. Pain in the back, jaw, or neck. Feeling pain in the upper back, jaw, or neck. This pain can be a symptom of a heart attack. Mild chest discomfort, experiencing mild chest discomfort that may come and go. This can be a sign of heart issue. We just saw in the previous slide that severe chest pain is usually occurs in the men, while milder chest pain will occur in the women who get a heart attack. And feeling unwell, feeling generally unwell without a clear reason, this can be a symptom of a heart problem. So, one has to realize that in men, the symptoms can be different, complaints can be different, and in women, the complaints can be some other than as compared to the men. Heart attack in women can be mistaken for acidity, stress, flu, or just tiredness. So you have to be very careful. Why this matters? Women's symptoms may not look like a classic heart attack. Delayed recognition can delay treatment, and delay increases the risk of serious complications or death. Therefore, one has to be aware that heart attack not always will come as only chest pain, though that is the most common way it presents. It can also come as shortness of breath, as pain radiating to the arm, jaw, neck, sweating, nausea, vomiting, etc. How this affects the heart? Blood flow becomes less healthy, blood vessels may stiffen or narrow, the heart has to work harder, risk of heart attack and heart disease increases. This is especially true for women. So we have seen that in women, the symptoms can be different as compared to men. Usually, dizziness, fatigue, stomach pain, nausea, pressure or tightness in the chest are there in the women. And in men, we have seen earlier that the classic symptom of severe crushing chest pain is more common in men. Thank you very much for listening to this talk of mine. And we have discussed today the very important thing that the symptoms of a heart attack can be different in men and in women. And next week, I'll talk about this same topic in Marathi and after that in Hindi. And I hope you like this talk. If you have already subscribed to my channel, I'm really happy. If not, please do subscribe to my channel, give me a thumbs up, and Also, let your relatives and friends know about my channel because I would like to spread this information to more and more people. Thanks again. Thank you very much.